The probe is positioned between the ribs and the mid-chest so as to obtain a coronal plane of imaging as previously described. The anatomy of the chest will be initially described using the cardiology perspective on the screen display. The structures visualized in the ultrasound beam are here displayed, as well as the surrounding structures, so as to keep a good overall orientation and perspective of the view. With the probe applied in an intercostal space in a longitudinal orientation, the ultrasound beam will first go through the subcutaneous tissue, fat, and chest wall muscles. The next structure to be encountered will be the rib cage. As was previously described, the ribs will absorb the ultrasound signal and will create a dark acoustic shadow seen as vertical black lines distal to the rib structures. These are called rib artifact or shadows. Between the chest wall and the aerated lung artifact, a bright horizontal line will be visualized. This line is called the pleural line, and it represents the pleural surface. The pleural line is in fact constituted of the visceral and parietal pleura that are closely opposed to one another when no pneumothorax is present. The visceral and parietal pleura will be seen moving on top of each other during breathing. This horizontal movement of the two pleural layers on top of each other is called lung sliding. Note that on ultrasound, the pleural line will most often be visualized as one single horizontal line. The bright pleural line and its horizontal sliding are here shown. When using a probe with a very high resolution like the linear array probe, the visceral and parietal pleural layers will sometimes be clearly differentiated from one another as shown here. In cases in which the visceral pleura would not be opposed to the parietal pleura, such as when a pneumothorax occurs, a bright pleural line would still be seen representing the parietal pleura. However, the lung sliding will be lost as the visceral pleura opposed to the deflated lung will no longer move with the parietal pleura. This is illustrated here by a clip showing a nice bright pleural line but no lung sliding. This patient was found to have a large pneumothorax on chest X-ray. The pleural line seen represents the parietal pleura only. The latter explanations helped clarify why the pleural line will in fact always be seen with or without lung sliding. When performing pleural imaging, remember not to center the probe over a rib. Doing so will prevent you from adequately assessing the pleural surface because of the rib and its acoustic shadow. Make sure you put the probe between the ribs, centered on the pleural line, with the rib shadows off to the sides. The pleural line acts as an interface between the chest wall and the aerated pulmonary tissue. This line is found approximately half a centimeter below the rib cage line. The pattern made by the ribs and the underlying pleural line have been compared to the appearance of a bat, in which the rib contours form the base of the wings of the bat and the pleural line forms the back of the bat. Hence the term that was given of the bat sign. Let's now review the ultrasonographic appearance of the structure that we just described. This will first be demonstrated using the linear probe. With its high frequency, the linear probe will provide a very crisp, high-resolution image quality with an excellent visualization of superficial structures like the pleural line and its sliding lung. Directly under the probe lies the layers of subcutaneous tissue, fat, and chest wall muscles. The contour of the ribs is then seen with their accompanying dark acoustic shadows. Approximately 0.5 centimeter below the rib cage line lies the hyperechoic, bright horizontal line called the pleural line. The normal pleural line will be moving forward and backward with respiration, the so-called lung sliding. As previously discussed, lung sliding represents the normal sliding movement of the visceral and parietal pleura on top of each other during breathing. Below the pleural line, artifacts created by the air-filled lung can be visualized. The normal alveolar lung parenchyma is filled with air, so that lung is not visible as a direct structural entity with ultrasonography. We can appreciate the pattern made by the ribs and the underlying pleural line, which resembles the contour of the base of the wings and back of a bat, the so-called bat sign. Despite the fact that the linear probe will be excellent for assessment of sliding lung and proximal chest wall structures, its low depth of imaging will not allow for an adequate assessment of the deeper pleural space and the surrounding structures and organs. This is why imaging of the pleural space will most often be done with the phaser ray transducer that will allow scanning at a higher depth. Despite not being as sharp as with the vascular probe, imaging of the superficial chest wall structures with the phaser ray probe will be very adequate. We can here visualize the pleural line, the faint rib shadows with rib artifacts, and the lung sliding. Once again, the bat sign can be appreciated. Imaging can also be obtained with the curved linear array transducer as shown here. The same structures previously described can be easily recognized. However, more rib artifacts will be seen as the footprint of the probe is larger.